On this channel, we talk about development all the time, but I rarely tell you what I actually do. So today you're going to get a little look into wilderness first aid, which is part of our trip leading program. Our trip leaders have to know how to tackle a situation when something goes wrong, so we practice wilderness medicine. So if you're interested in wilderness first aid for some reason, or getting a glimpse into what I do, kick back, relax, and stay tuned. If you're one of my students, make sure you watch this entire video because you need to know all of this information and the structure before you go into studying for the practical lesson. So, without further ado, this is Wilderness First Aid. It's just a triangle with a bunch of different divisions. And the first one is the scene size up. And the key thing with the scene size up, why this exists, is to keep you safe, making sure that the scene is safe to enter. And with the scene size up, the first thing that we're looking for is I'm number one. All of these rhyme and they fit on your hand. So go along with me. One, I'm number one. With number one, we are looking for any hazards to the scene. Is it safe for you to enter? Because we don't want to create a second patient. We don't want to put you in the same situation that the person you're trying to save is currently in. So if your patient is laying in a vat of toxic waste, we're not going to go into that situation. If your patient is getting mauled by a grizzly bear, you're not going to fight that grizzly bear. You come before anyone else. One, I'm number one. Two, what happened to you? We are looking for the MOI, or mechanism of injury. So we want to know what happened. Is there a turned over ATV and they're currently clutching their head? It was probably an ATV accident. We want to know what happened to them and the mechanism of injury before we even walk up to them. Three, not on me. We are going to create BSI, or body substance isolation. So body substance, blood, guts, things that can transfer through skin, blood. We don't want those things on us. So we're going to isolate ourselves from that stuff by putting on gloves. So we're always going to have gloves on any time that we respond to an emergency. Four, how many more? We want to know how many people we're treating, because whether we're treating one person or 40 people completely dictates how we go about that. So make sure you're looking. Are they behind a tree? Are they in some bushes? Are they in the river? Make sure we figure out, check the immediate scene, how many people are there? And five, how alive? We want to know what signs of life do they have just looking at them. Are they screaming and yelling and rolling on the ground? That's actually probably a good sign. If they are laying unconscious, not moving, that's probably a bad sign. So we want to know before we even walk up to them all five things. So before you even question any of these five things, I want you physically taking a step back so you can take a step forward. Make sure that that scene is safe. If you don't take a step back to take a step forward and you just rush into a scene, you are at danger. We don't want you in danger because then who's going to save who? So one, I'm number one. We're looking for hazards. Two, what happened to you? We are looking for the mechanism of injury. Three, not on me. We're going to immediately put gloves on to create body substance isolation. Four, how many more? How many people are we treating? And five, how alive? How do they look before I even get to them? So you're going to do this before you even step foot close to that scene. Make sure that all of these are good. So once all of those are good, you can actually walk up to them. So when you walk up to them, there's an introduction phase. So with the introduction, you're going to have a bunch of different things. Three specific things that you have to do for the introduction. Hi, I'm blank. This is the introduction part. Two, I'm trained in. This is where you input your certification. And three, can I help you? The most important part, getting their consent to help, which they might say no. And if they say no, you can't help them. If they are unconscious, that is implied consent. Any unconscious person, we are going to automatically assume consent and help them out. So anytime that we walk up to a person, especially a stranger, imagine if you are injured and a stranger just comes walking up to you and starts taking care of your broken leg. They just start touching you and pulling out equipment, you'd freak out. So we want to make sure that they know who we are. We're building that rapport. We want to make sure that they know we are trained in this information, and we need to get their consent to legally help them out. So pause this video and practice this at least 4 times. Hi, I'm Austin. I'm trained in wilderness first aid. Can I help you? And if your name isn't Austin, input your name. Okay, hopefully you got some practice in and that introduction is looking good. So after the introduction, we can go into life threats. A, B, C, D, E. We want to make sure that there are no immediate life threats before we go into tackling the issue. So these are all stop and fix issues. Regardless of what injuries they have, if any of these aren't good, we have to stop and fix whatever's wrong. So life threats, A, B, C, D, E. The first 3 you should be familiar with because they're from CPR. Airway, breathing, and circulation. So if they are talking, you know that their airway is open and that they are breathing. So talking is a good thing. So when you get their consent and they verbally say yes, we automatically can check those 2 things off our list. Now with circulation, we're going to check their pulse to make sure that they have a pulse. But something with wilderness first aid, not a part of CPR, is the blood sweep. So with our gloved hands, we're going to quickly go through and check if they are pooling any blood around their torso and limbs. So if you go under a leg, you're going to pull your hands out, look at your hands. If there's blood on your hands, you know that they're bleeding out, and you have to stop and control that bleeding. If there's no blood, you're good to move on to D, which is disability. And really on this one, we are looking for the mechanism of injury. Was it a high mechanism of injury or a low mechanism of injury? So if it's a high velocity ATV incident, there's a good chance that they have a spinal injury. So we're going to assume spinal, assume that they have a disability, and go into inline stabilization, which we will practice on the hands-on portion. After you've made the decision on whether or not to go into inline stabilization or not, you can go into E, expose/environment. So expose, we need to get every single injury down to skin level. We might have to tackle more issues than just what they are feeling. So you need to put your eyes down to skin level on that injury. If that involves taking off a coat in the middle of the winter, you gotta take that coat off in the middle of the winter and then quickly put it back on after you've put eyes on it. E for environment is your surroundings. Is it all right now in your current environment to perform whatever treatment you need to perform, or is there something dangerous? Is there a thunderstorm? Is there a tornado rolling in? Is there a grizzly bear over in the field over there? Does your current environment dictate any life threats? And if it does, we have to change that environment. Actually, after that, we are good with primary assessment. So primary assessment is just the making sure nobody's going to die, right? After primary assessment, we can take a breath. So everything dealing with wilderness medicine revolves around the saying that seconds never matter and minutes rarely do. You taking time to take a step back so you can take a step forward, those seconds that you're going through seeing size up do not matter. Take that time, because if you don't, bad things are going to happen, or they have the potential to happen. And with life threats, after you've done life threats and they're not in any immediate danger, you have all the time in the world. Take the time to go into the next portion, which starts with the head-to-toe exam. So when we go into the head-to-toe physical exam, we're looking for a lot of stuff, and we will practice all of this in the hands-on portion, but you need to know a general glimpse of what we're checking for. So what you're checking: the head, face, neck, and ears, the chest, abdomen, and pelvis, the arms and legs, and the back. Now, the manual goes into detail, so much detail, about what you're checking on all of those different things. Make sure you have an understanding of what you're looking for, and then in the hands-on section, we will actually practice how you look for those things. So we'll practice checking the arms and legs. Now, the last portion with the physical exam is CSM, or circulation, sensation, and movement. So circulation, C, is their pulse regular and strong? Do they have a pulse in their feet? So when you check their boot, are their feet warm? S, sensation. Can they tell which side of their hand or foot you're tapping on? When you tap on their index finger, can they tell you that you're tapping on their index finger? When you tap on the right side of their boot, can they tell you that you're tapping on the right side of their boot? If not, we got some problems. M for movement, range of motion. So is their movement good? Have them press on the gas and then pull against your hand. So do their feet have movement this way? And then when you go to check the hands, you will have them squeeze your fingers. We'll go more into depth on CSMs and the physical exam when we do it in person a couple weeks from now. So after the physical exam, the head to toe, we can move into vitals. So vitals, this is really all about collecting data. We want to make sure all of this is going to clue us into what is going on with this person. So with vitals, there's a few things that you're looking for. The first one is levels of consciousness, or LOC, and it's on the AVPU scale. So AVPU stands for alert, verbal, pain, and unresponsive. They fall into one of those 4 categories for their level of consciousness. If they are alert, they are up, and we'll go into more detail about the criteria for that. If they are not like moving and responding to you verbally, hopefully they are verbally responsive, where you can say something and they have some sort of response. They might try to move, their eyelids might blink, they might verbally talk to you. Those are all different examples of responsiveness. Now, if they're not responding to your voice, hopefully they are responding to pain. So if you do a sternum rub, take your knuckles and rub them on your sternum. It's real uncomfortable, right? You can also take a pin and push it into their earlobe. So inflict some minor pain. And if you see any responsive, that is better than being unresponsive. So if there is no response to pain, they fall into the unresponsive category. And all of those things just help us place them in different categories to figure out what their treatment looks like. Now, going into more depth about the alert, there's A and O, alert and oriented. And you can be A and O times 1 through 4. So if you get 2 of these criteria, you're A and O times 2. If you know all 4 of these criteria, you're A and O times 4. So if you can tell me who, where, when, and what, you are A and O times 4. So who, what is your name? Where do you know where you're at right now? When, do you know what day it is? What happened before you got hurt? What were the events leading up to the injury? So if they can tell you 4 of those things, they are A&O times 4. If they can only tell you 1 of those things, they are A&O times 1. So that is the first portion of the vitals. The next 4 starts with the respiratory rate. So how many times are they breathing per minute? And the normal is 12 to 20, unlabored, and regular rhythm. Next up is heart rate. How many times does their heart beat per minute? Normal is 60 to 100, strong, and a regular rhythm. Next up is skin color, temperature, and moisture, SCTM. Normal is pink in non-pigmented areas, or if you're familiar with a person, it's their normal skin tone. Warm and dry. And last but not least is pearl. Pupils are equal, round, and reactive to light. So pupils are equal from the right side to the left side. One's not bigger than the other. They are round, so they're not jagged. They're nice circles, and they react to light. So if you are outside and it's sunny, you can have them close their eyes, and then when they open their eyes, their pupils should get smaller when they see that sunlight. So vitals. Let's do a quick recap on vitals because I know that was a lot. So levels of consciousness, LOC on the AVPU scale, alert, verbal, pain, or unresponsive. If they are alert and oriented, A&O times a number. That number is equivalent to how many of these questions they can answer. What their name is, where they are currently located, what day it is, and what happened before they got injured. Now with the respiratory rate, 12 to 20 is normal, unlabored, and regular. The heart rate, 60 to 100, strong and regular, is normal. On skin color, temperature, and moisture, Normal is pink in non-pigmented areas or a normal skin tone, warm and dry. And then last but not least, pearl, pupils are equal, round, and reactive to light. And that is the vital section. So moving on to the last portion of this section, we have sample. And this should be the easiest one because this is just about the same thing from CPR. So when we go into sample, we want to know S for signs and symptoms. So what are they saying that their symptoms are? Is it a hurt left leg? That could be a symptom of a broken leg. Are signs? What are we seeing? What are we observing that could tell us they have a broken leg? On to A for allergies. I want to know what they are allergic to, specifically if it has to deal with immediate concerns. So anything that would put them into anaphylaxis, which we'll talk about as a treatment section, anything like that, I want to know to make sure that they don't go in that direction. Next up is M for medicine. What are you currently taking? What's in your system? Illegal, over-the-counter, or otherwise. What is currently in their system, because I don't want to give them anything that's going to conflict with what's in their system. What's in their system as far as what they're currently taking? What should they be taking that they're not on currently? And then where is their medication located right now? On to P for past and pertinent medical history. I don't care that they had their tonsils taken out in first grade. That does not give me any information. I care about the head, heart, and lungs. Anything dealing with that, I want to know because that's going to give me more information when it comes to treatment. L for last ins and outs. It's gross, but I want to know when you last peed, when you last pooped, what you last drank, and what you last ate. So the only difference here between CPR and wilderness first aid is peeing and pooping. I want to know what that stuff is because that's going to help me determine, especially if we're talking about days in the field, especially then, I want to know what can help make you better. So that's going to give me some more information. And last but not least is E for events leading up to the injury. What happened? That's going to give us some information about how to tackle these injuries. So that is the last portion of secondary assessment. So you knew there was a primary assessment. You knew a secondary assessment was coming. So what are the differences between primary assessment and secondary assessment? Primary assessment is all about, why are vitals up there? Primary assessment is all about figuring out what's immediately going to impact. Are you in danger? Are they in danger? Are there any life threats happening? That's primary assessment. That you need to move quick on. Seconds never matter, and minutes rarely do, but those are the big things. After you get through primary assessment, you can take a few breaths, not just one breath anymore. So secondary assessment is all about collecting data to figure out how you can best treat them. So the difference between heart rate of 60 and heart rate of 120 could be the minute difference between a treatment that you're going to do. So the more data you have, the more information, the better you can treat them. So after secondary assessment, now that you have all of your information, we can start to create a plan. So what does evacuation look like? Are we getting them out of here? Are we taking them home? Are we taking them to a medical facility? Do we need to get medical personnel to us instead of us to medical personnel? What does your plan of leaving look like? Do you need to leave? Second portion of that is what treatment are you going to give them? What is appropriate in the moment? And speaking of treatment, that is the next box, and that box is the most convoluted. So the difference between a serious head injury and a mild head injury, those are very minute differences between the two, but we're going to do drastically different things for them. So treatment has 100 different ways you can go, but the structure of this entire triangle, you're going to do this every single time, regardless if they have a broken leg or a serious head injury, which are treated completely different. You're still going to go through this pyramid from step 1, scene size up, to the last step that is monitor. Because if you're using your wilderness first aid skills, you're not using them in suburban areas or urban areas. You're using them in the wilderness. Wilderness is defined by being 1 hour away from definitive medical care. So if there is not definitive medical care, a hospital or an ambulance, an hour away from you, that's when we're using these wilderness medicine skills. And more likely than not, you're going to have to continually monitor them while you're evacuating, or if you're staying there, you're going to continue to check up on them. So, monitoring a serious head injury, we're going to do that every 15 minutes. We're going to redo secondary assessment, go through the head to toe, or at least the physical exam on what's injured, take their vitals, do sample every 15 minutes. Now, if they just twisted their ankle and we're walking back to the car, I'm probably not going to do that every 15 minutes, right? I'm going to check up on them and see how they're doing if they need anything, but we're not going to go through the entire secondary assessment for a twisted ankle. So that treatment portion, what's actually wrong with them, that's going to change every single time that you do this stuff. The pyramid, though, the pyramid stays the same every time. Okay, so that is a very quick rundown on wilderness first aid. Make sure you know the structure going into studying your manual, and make sure that you study your manual and know all of the different treatment stuff going into our hands-on session. As always, if you have any questions, let me know. If you need to rewatch this video a couple times, rewatch it, pause it on the portion that you're doing your manual with, whatever you need to do to know this information. This is just a quick rundown on the structure of wilderness first aid. Okay, for some reason, if you have stuck around and you're not my students, which I love my students as well, but for some reason, if you stuck around for like 20 minutes to watch this whole thing, thank you. And as always, I love you, I'm proud of you, and I'll see you next time.